All right, Johnny Nelson here with the Bone and Joint Surgery Clinic. So I've got Jack here, my assistant. We're going to go over what's called phase 2 exercises. These usually start around 4 or 6 weeks after the surgery. And the main goal here is, unlike the phase 1 exercises where you're keeping that arm very loose and kind of dragging it along for the ride, these exercises are going to start to engage the muscles around your shoulder and actually use that shoulder strength to move your shoulder. The first thing to notice here is the posture, right? So lying down is very important for several different reasons. Number one, it changes our relationship with gravity. When I'm standing up and lifting my arm, I'm working against gravity with the muscles in my shoulder. Whereas Jack here, he's lying down, and so once he gets to this point right here, this is a zero gravity right here. His arm is parallel to the direction of gravity. There still is some gravity in play at this position, but you can overcome that with help from the other arm. So that is one of the reasons why these are good lying down. The other thing too is that when you're lying down and you put your shoulder blade onto a hard surface, it really forces you to rebuild a normal rhythm to the motion in your shoulder. What most patients do, which is a normal reaction to shoulder surgery, is when you're trying to rebuild that active motion, the tendency is to use your shoulder blade and to use other muscles around the base of your neck and in your back to lift that arm. That's an unhealthy pattern of movement that we want to discourage. So lying back immobilizes your shoulder blade and encourages a more normal, fluid rhythm to the shoulder. So those are two reasons: gravity and the fact that it stabilizes your wing blade. So when I tell you to start these phase 2 exercises, you'll probably be about 4 weeks, sometimes 6 weeks. In some patients, every once in a while, depending on the surgery we do, we'll have you start doing this at 2 or 3 weeks even. Again, multiple times throughout the day, very short exercises is preferable. So I don't want you doing marathon 20, 30 minutes of this. The main goal is to lay back. The first time you do it, you're probably going to want some help from your other arm. So you want to bring that other non-operated arm over to this side and grab that arm that was operated on. And you basically just want to bring that arm up to zero gravity, right? So we're going to bring up to zero gravity. And now notice this here, elbow is straight, wrist is straight. And at this point, if you're able to do so, you can let go with that other arm and just hold it under your own strength. The first time you do it, that may be all you can do, and that is okay. You also might be to the point where you still have to kind of hold on for a little while and hold it with the other arm. And maybe that's all you can do. If that's the case, and that's fine, hold it there for a little while, then slowly lower it back down. Now, once you're at this position, and we'll bring this right arm back down, and you're at this zero gravity position, right? There's 2 different things I want you to be working on in this position. Number 1 is what I call little windmill movements here. And so you're going to start small with windmill movements. You need to focus on not moving your elbow. So you don't want you to move your elbow or move your wrist. It's not in your wrist, it's all in your shoulder. What this is doing is engaging and firing the muscles in your chest, around the back, your deltoids, and helping to bring those muscles back into your shoulder movements. And as you're able to, you can get a little bit wider with these movements as you have more confidence and more strength and your pain levels go down. The second thing we're going to have you do is, in addition to the windmills, we're going to start having you bring that arm back a little bit. This is another reason why the lie down position is great, is now gravity is actually helping you stretch, right? You want to bring it back to the position where you feel the tissue kind of pushing back against you. You want to hold it there for about 5 to 10 seconds and then come back here to that zero gravity position. So windmills, coming back to stretch the arm out a little bit. When you're able to kind of, when we clear you to do so, you could also hold that other arm, right? Sometimes, especially when you're coming back like this, you want to hold it with the other arm and kind of guide it back. And you can even push it a little bit with your other arm to bring it further to further extremes of elevation. When you're done with these exercises and you're back to zero gravity, you can either do some more windmills or you can just lower it back down, right? Now, as you progress, you can start to build in more just quick elevations of the arm. So just doing reps back and forth from this to the zero gravity and back. That's really helpful too, because it can help retrain the muscles around your arm, as we mentioned, with a more normal rhythm to rebuild that motion so that when you do sit up to start doing active exercises, you're not going to be hiking with your scapula and wing blade. So hopefully that's really helpful to clarify the phase 2 exercises. Again, we'll let you know when you can start with those. But hopefully this video has been helpful, and let us know if we can clarify things anymore for you.